In the early 20th century, an insidious epidemic swept through the rural landscape of America's Deep South, bringing with it social and economic devastation. The name of the silent scourge was hookworm disease. This is the story of the collision of this devastating parasite with a perhaps unlikely hero, and of how this event sparked sweeping changes in America's approach to tackling critical healthcare challenges, changes that reverberate to this day in the lives of millions of people across the globe. The hookworms at the center of the American epidemic were called Necator americanus, American killer, and likely were introduced to America from Africa with the slave trade. Hookworms were spread when infected hosts, including people, deposited feces containing hookworm eggs near warm, moist, shady soil. Newly hatched larvae burrowed into a passing victim's exposed skin and traveled through the veins to the heart, lungs, and ultimately the intestines. There, the hookworm fed and mated, and the cycle began anew. In poor, rural areas of the South, the hookworm found an ideal environment due to the widespread use of open and unsanitary privies.
Practically all the children went barefooted, and they didn't always use a facility to deposit their human waste, and so they were on the ground. And these barefoot boys would walk through this material, and these organisms, the hookworm, would get into the bloodstream, and you know what happens when that occurs.
The extended stomachs and pronounced shoulder blades of victims were termed potbellies and angel wings by Southerners, to whom these symptoms were becoming more and more a part of everyday life. For many, complications from the disease led to death. Most victims were oblivious to the cause of their sickness. Before 1900, very few American doctors knew about hookworm disease. In the afflicted areas of the South, only 3 states had health departments, and just a few southern cities had a full-time health officer. Few resources existed to try and battle an epidemic that now stretched from Virginia to Texas and afflicted an estimated 7.9 million people, 40% of them children. The epidemic devastated the southern economy. Millions of sick and exhausted workers and farmers found that their strength could not sustain their ambitions. School attendance dropped radically, and incomes in families with infected members lagged badly. At a social level, the symptoms of the nameless disorder seemed to feed into simmering stereotypes of laziness and subpar intelligence that haunted many Southerners. In Washington, D.C., though, an obscure zoologist named Dr. Charles W. Stiles connected the dots between hookworms and the mysterious epidemic raging in the South. In 1902, he reported to the Sanitary Conference of the American Republic that he had discovered the germ of laziness. The culprit now had a name, the hookworm. For Stiles, battling the hookworm epidemic proved challenging. The South had little organized healthcare or sanitation infrastructure. The federal government lacked the resources to deal with the scale of the problem. Outreach programs for preventative measures and treatments would have to be created from scratch. And of course, there was the pressing issue of funding. Stiles tirelessly spoke publicly about hookworm disease, and over time worked out a novel framework for fighting the disease. Then, in 1909, a chance encounter landed him a meeting with Frederick T. Gates, a Baptist minister with close connections to one of the most powerful men in America, John D. Rockefeller. Born in 1839 in Richford, New York, Rockefeller grew up in humble surroundings. An ambitious youth, Rockefeller once reported to friends that his greatest ambitions were to make $100,000 and live 100 years. In 1863, Rockefeller and a partner built their first oil refinery near Cleveland, Ohio. By 1872, Rockefeller's Standard Oil had absorbed most of his Cleveland competitors, and he was just getting started. Rockefeller soon controlled 95% of the refining capacity in the United States. Rockefeller accumulated vast wealth, becoming a billionaire. He also acquired enemies and critics, who loudly and publicly decried what they described as monopolistic practices and heavy-handed tactics with customers and competitors alike. When Stiles finally met with Rockefeller's associate, Frederick Gates, in 1909, Gates was struck by the audacity of what Stiles had conceived, a plan using private wealth to create durable public resources that could serve the healthcare needs of all citizens in the long term. The plan called for Rockefeller funding a commission focused on the eradication of the hookworm. The effort would channel information about treatment and prevention through newspapers, fairs, churches, and, perhaps most importantly, women's groups.
Once you got those women interested in it, believe me, things moved. They got these politicians and they told them what they wanted. Say, we want this health department that this man's talking about.
The revolutionary nature of Stiles's concept was not lost on Gates, who enthusiastically briefed Rockefeller. Rockefeller was won over, and on October 26, 1909, the Rockefeller Sanitary Commission for the Eradication of Hookworm Disease was founded with a $1 million Rockefeller grant. Gates was named chairman of the commission, and by January 1910, the commission was at work. The commission helped fund the health offices that became the backbone of the South's public health infrastructure. These offices sponsored the construction of sanitary projects and established traveling medical dispensaries for diagnosing and treating hookworm disease. Teams spread out to inspect poorly constructed privies and advise residents of risks and remedies. The commission also produced a first-of-its-kind educational short movie titled Unhooking the Hookworm, featuring basic information on the prevention and treatment of hookworm disease, which was played at countless fairs and gatherings in the South. As the commission's teams spread across the South, hundreds of thousands of victims were successfully treated and cured. New hookworm infection rates began to plummet. School attendance rates began a slow and steady rise. As more and more people were successfully treated and new cases dropped, income growth resumed among families with previously infected members. By 1914, hookworm disease was essentially eradicated across much of the South. If this were the end of our story, we would be left with a compelling tale of a nearly unknown turning point in American history, especially the American South. In just a few short years, the Commission's efforts radically improved the health and fortunes of millions of American Southerners through the eradication of hookworm disease. This in turn enabled major advances in the economic and social development of the South that would not have been possible without the vision and commitment of people like Stiles and Gates and the financial support of Rockefeller. The work of the Commission represents a much larger turning point as well, the echoes of which impact literally billions of people across the globe.
The Rockefeller Sanitary Commission was the first broad-based effort to achieve a public-private partnership for health. It was an idea that has become a global model over the centuries since. Successful private citizens, often through the philanthropic foundations they create with their wealth, work cooperatively with government agencies to achieve advances in public health that might not have been possible otherwise.
In our times, echoes of the Commission's work are visible around the globe. The Bill and Melinda Gates Foundation provides grants to help local governments combat diseases such as malaria, AIDS, and yes, even hookworm disease in developing countries. The Robert Wood Johnson Foundation funds grants to help local governments implement disease prevention programs here at home. And of course, the Little Commission founded by John D. Rockefeller to stop a worm in the South has grown into the Rockefeller Foundation, which continues its tireless work around the world to end diseases and save lives. The transformative path blazed by Rockefeller's commission has truly changed the world for the better.
Out of its approach came breakthrough achievements such as a vaccine for yellow fever and the professionalization of the field of public health, the spread of Western medicine around the world. It was very ambitious work with a global reach, the first global philanthropy of its kind. It expanded the frontiers of knowledge and it improved the lives of millions.
As we confront the challenges of the future, it's good to remember that a century ago, the path to successful public-private health initiatives was first pioneered by the nearly forgotten Rockefeller Sanitary Commission for the Eradication of Hookworm Disease.